Health spokesperson Janela Carrera to kind of unpack a lot of the testing and the numbers that we saw this weekend. Good morning, Janela.
Hey, good morning, Kristen Bree. How are you?
Doing pretty good. A little freaked out about the 120 positives. I know Jason did the math. He's the math guy around here. What was the positivity rate there, Jay?
24.5% positivity rate.
Right.
That's pretty high.
So I guess, Janela, we'll just start and give you the floor. And if you could just run through some of the numbers and the testing and the things that we saw this weekend with the virus from public health.
Sure, yeah. So on Saturday, we did our community outreach at the Estimbo Gym. We had 179 samples collected from the Estimbo outreach. Of that, there were 22 that turned out positive. So that could have contributed to the 120 positive cases that we reported in the Sunday JIC. Actually, we registered more than 200, which was the limit that we had set. But we had 179 that showed up. It is an alarming number to see 120 rather, excuse me, of the 400 and some. And you're right, Jason, that's about a 24.5% positivity rate. But, it's an unpredictable number. Just the weekend before, we had 9 positives, 3 positives, and then a week later, 120. So it really just underscores the unpredictability of COVID-19.
Is there anything else that you could tell us about this press release that came out of Black Construction and the cluster that they were referencing?
Yeah, so public health is actively engaged in testing the construction workforce for Black construction. We are confirming that. We are testing their entire workforce. It's ongoing because they do have a large workforce. We did issue a letter to them asking them to cease all operations while we are testing their employees and staff. It's been ongoing for a few days and testing is continuing. It hasn't been completed because there is a large number of employees there. As far as numbers, I'd rather that Black Construction be able to provide that to the media because those cases are under investigation. Our team is active. We're working with them very closely to monitor all the positive cases as well as the negative cases to ensure that there is proper isolation and quarantine measures, mitigation measures, to not only protect their employees, staff, and workforce, but to also prevent any risk of spread to the community here in Guam.
Mm-hmm. Can you say how many have been tested so far?
I don't have the exact number on me, only because it's ongoing. I want to say because we started late last week and it's been ongoing, the number changes. I know that yesterday we were there on site and we tested a large number of their workforce. And then we're continuing today. So I'm not sure if the workforce that we're testing today is going to complete all of them. And then if we're going to continue again tomorrow. So it's a substantial amount that we've tested so far. We started, I believe it was last Thursday, and then we continued Friday. And then I think we paused on Saturday because we did the community outreach for Estimbo, and then we continued Sunday, and then we're continuing again today. So it's a pretty substantial amount that we've tested so far, but we are continuing to test their entire workforce, including their staff and management as well.
Okay. Can you bring us up to speed on what's next? You had the public hearings on the fines and fees, and I guess has it closed already to provide public testimony?
Yeah, so we did, we had our last public hearing on Wednesday, and then we were taking written testimony up until 4 p.m. that same day. We did receive some through our email address, and we're actually going to be meeting this week to look at all the testimony, written and oral, and discuss, all of the the testimony that we received. We will be refining our draft rules and taking into consideration all of that. And I can tell you that the version that will come out of the initial draft that was created will not look like the draft that was issued and is on our website now. So, and that's the beauty of the public hearings that we had and the written testimony that we received, is that the process is really it was built to really engage the community and really take into consideration what they had to provide. And we really wanted that input. So again, what we are going to be putting out will likely be looking different from what what was initially issued by public health.
Mm-hmm. Do you guys have any kind of estimated time when that will be finalized? And you put it out to the community and it's final, right?
So we'll be using this week to refine it, and then it'll go through like a legal review. And then after that, we'll provide it to the governor for her concurrence. I'm not sure if her legal team will look at it as well for their legal concurrence. And then after that, it'll be adopted, and then we'll provide copies to all three branches of government.
So maybe,
and of course, that process as well, it won't just be, it's adopted and, we'll put everybody on notice. We'll give time to educate the community about what the newly adopted rules will be. And, depending on what the newly adopted enforcement rules will be, I think it would be incumbent upon us to ensure that residents in the community are aware of what could potentially be, if there are any, what the fines could be, what they range, whether or not it involves warning first before there are fines. I think that was one of the suggestions that were made during the public hearing last week. So just really depending on what the rules would be, there would be an educational campaign to ensure people are aware of what is included in what the newly adopted rules would be.
So we're looking at weeks, maybe a month before full implementation?
Maybe a week, couple weeks for that legal review. I think, the intended goal of the executive order was so that it would be as expeditious as possible. The AAA process, the administrative adjudication law was, I think it was a 90-day process. And the executive order was really to give public health a time frame that would allow it to be a lot shorter. So we want to do this as quickly as possible, but also given some time that would allow us to do it in a way that was prudent, and that would also allow us to give the community some time to absorb any information that's contained in it.
I wanted to go back to Black Construction, and just for clarification, was the Rapid Enforcement Team activated to handle that response at Black Construction?
No, this was not a rapid engagement team mobilization or project. Rapid engagement team, the way that it's handled is typically we go out into a community and we set up like our mobile lab. We go out door to door. We do active case finding. When it comes to Black construction or any type of community outreach like Estimo Gym or like the one we did at Jigo Gym, typically we already know who the constituents are, and we set up an area where people are coming in, whether it's through walk-in or drive-through, and we have a stationary area where our nurses are, and they're coming up to get tested. In a rapid engagement team scenario, we're going out to the residents, we're doing active case finding. So it's a little different.
Okay.
So this was not a rapid engagement team mobilization.
You know,
Are you-
oh, go ahead.
Are you planning on, is Public Health planning on any other rapid engagement team mobilization efforts?
Yeah, actually, we are, and we are in discussion about that. We are working with respective mayors about the next potential areas that we'd like to set up and activate the rapid engagement team in. There are some potential areas. It's just a matter of determining, you know, the high risk factors, scientific evidence. So that is something that we are continuing to discuss. We're working with, I think it's in the Dedido area is the possibility. So we're working with the Dedido Mayor's Office and the FSM community and consulate office on that.
And then you guys are heading to what you're doing, testing a DOC tomorrow, right?
Today.
Today? This week?
I believe so. Yeah, sometime this week.
Okay.
All right.
Yeah, so that's another one. So we're our nurses, our team, we're just continuing to test, and then on top of that, we still have our northern clinic that's open,
Right.
you know, every day except Sundays. So we are busy.
That's an understatement, right?
Thanks, Janela.
Thank you,
for the
Janela. I appreciate
update.
your time.
Yeah,
There's virtual
Sure.
banana
of
donuts
course,
if,
anytime, guys. Thank
if
you.
you want to take some on your way out.
Oh, my favorite.
Okay, right on.
Thank you.
Okay, we'll see
care.
you. Bye. It's 9:06. We'll take a really quick break, and we're coming back with more of the Link of the Breeze 93.9 as Jason Solis is going to put on his biker.